How do you recover from COVID brain? And this is a topic that has been posted numerous times, frequently the past couple of years in our private Facebook group, which has over 100,000 members. I know many of you are part of it. Also in our Quick Brain app, and you can get that at our Quick Brain Universe app, which is found in your app store. And so I want to talk about this in depth with a guest of ours. And the guest is Dr. Daniel Amen. He is author of 12 New York Times bestselling books. He's a psychiatrist, a board-certified physician, and he's done over 200,000 brain scans, including yours truly. And we're having a conversation about the effects of long-term COVID, specifically towards the brain. You know, we're all familiar with some of the symptoms that maybe you or loved ones have experienced, whether it's fatigue, shortness of breath, cough, joint pains, chest pains. But what I want to talk about is a little bit of how it's affecting the brain, since this is a brain-dominant show. Memory, concentration, sleep issues, loss of smell or loss of taste. Let's talk about mental health. You see the shirt I'm wearing if you're watching this on our YouTube channel, which I encourage everyone to subscribe to. That's where we put the extended version of these conversations. It talks about mental health and wellness, but depression, anxiety, loneliness, people feel more sadness than ever in the past couple of years. And so what is this? What's going on? And specifically, what are some things, actionable things you could do in your day-to-day lifestyle to help mitigate those kind of challenges? Now, I encourage you when it comes to this topic, to seek a professional health practitioner. This is not meant to diagnose or to treat anything. You take personal responsibility by listening to this. I want to welcome Dr. Daniel Amen. He's author of a brand new book also. And this is something that people want more of, right? They want to feel, again, it's called You Happier if you're not seeing me on screen. Welcome, Dr. Daniel Amen.
Jim, so great to see you. Such an important topic, coming out, hopefully, of the pandemic. There's a lot of people that have been impacted by COVID and sort of the long-term effects of what we call at Amen Clinic's COVID brain.
And so I encourage everybody to contact, stay in touch with your health practitioner. This is neither diagnosing or treating anything in this conversation. You, the listener, you take responsibility. But Dr. Amen, I want to talk about your patients. What are you seeing right now and the after effects, during, after, and what kind of recommendations are you giving people right now in terms of what are you seeing that's working for people, especially maybe you could talk about some of the effects that it's having. Specifically, what our listeners are concerned about is their brain health.
So it's very common. In fact, people who get COVID, 20%, according to a study from Sweden, will have a new mental health challenge, new mental health diagnosis after they got it. And so right away, you go, COVID affects the brain. Because as you and I both know, I actually hate the term mental illness because it's not mental, it's brain. These are brain health issues that steal people's minds. And almost as soon as the pandemic started, we knew it affected the brain because people lost their sense of taste and smell. And then we saw the increased incidence of anxiety and depression separate from the pandemic isolation and fear. And then we saw some people had seizures. A lot of people had brain fog. They started not liking food, so their appetites went away because of the change in their sense of taste and smell. They became more irritable, more anxious. They started having muscle spasms and just this sort of chronic unhappiness. And as I started scanning people, because my wife's assistant got COVID, and she changed. She's more irritable and more anxious. And some people even become psychotic. They become paranoid. So I scanned her right afterwards. And like a bomb went off in her emotional brain. You just saw the inflammation of her thalamus, her basal ganglia, the amygdala, the hippocampus. It's like, boom. We saw what we often see with things like Lyme is initially you see inflammation of the brain structures, the limbic or emotional brain structures. And then I saw it consistently. I had an NHL player who just wasn't getting better. Then I had, some of my long-term patients where I already had their scans, and then I got it after COVID. And then for the people who have long COVID, sort of like with long Lyme, they had these overall decreases. I mean, you can really see the damage to their brain. So what do you do? Well, the first thing you do is you have inflammation. So I got COVID on New Year's Eve. And now imagine I've seen hundreds of COVID brains. And so now I'm worried about mine. And so what did I do? And what do I recommend my patients to do? So I'm not your doctor, but if I was your doctor, omega-3 fatty acids, high dose of vitamin C, high dose of vitamin D. I want you to get your level to like 80, 90, 100. So normal is between 30 and 100. Optimal for a pandemic is more like 80, 90, 100. You want it high normal. Multiple studies now on vitamin D decreasing the risk of side effects from COVID. Quercetin, because it decreases inflammation. Curcumin, because it decreases inflammation. So every morning I make myself this great shake. Protein powder, Bright Minds powder, it's multiple vitamin and brain boost. Smart mushrooms boost your immunity. Vitamin C, Neurogreen, so as many green plants you can get into your diet, the better. And then I'm just really serious about what I eat. And resting. I think resting is really important. I'm sort of like the Energizer Bunny. I inherited that from my mom. When I got COVID, I started taking naps. And I'm like, oh, this is how it's going to affect me. But I think doing all the right things, and for some of our people, we put them in a hyperbaric chamber, helps them so much, because hyperbaric oxygen can increase blood flow to the brain, but also decrease inflammation.
And really what I want, and again, everyone should talk to their health practitioner. Everyone's bio-individual, and again, not intended to diagnose or treat. But what this episode is, this conversation is about hope, and it's about help. That there are things that we could do when it comes to our lifestyle in terms of how we move, how we breathe, how we eat, how we engage our brain, to be able to mitigate, the damage, and also give us an opportunity to be able to reclaim, the level of brain health that we desire and really, really deserve.
Well, and so many people are going to go see their doctor and say they're anxious and depressed. I want you to be thoughtful about that, because just going on a benzo may make things better in the short run, but worse in the long run. Now, one of the most interesting findings in the pandemic was Luvox, an SSRI, FDA approved for OCD, was shown to significantly cut deaths and hospitalizations from COVID. And you're like, why would that be? And what I've seen consistently over time with the SSRIs is they calm down activity in the brain. So if you have ADD, for example, they wouldn't be good because they'll make you more ADD and you won't care that you are. So that's where the scans come in. But I found it particularly interesting that if you're struggling with worry, with your mood, finding natural ways to boost serotonin, that's what Luvox does. It's a selective serotonin reuptake inhibitor, 5-HTP, exercise. There are certain ways to eat. I talk about it in my new book, You Happier, that can boost serotonin. That is really a good strategy. And then for some people, an SSRI may actually be helpful for them. Of course, you should talk to your doctor about that.